Dermatologist Debriefs. Join no-nonsense dermatologist Dr. Stefanie Williams as she debunks myths and shares her professional insights, separating facts from fiction in just a few minutes.
Hello, this is Dr. Stefanie. Today I'd like to talk about the most common mistakes aesthetic doctors and nurses make when doing lip fillers. For the avoidance of doubt, I'm not against lip fillers at all. It's really an amazing treatment when done correctly, but when done incorrectly, it looks terrible. And I just saw one of those really bad examples on Instagram where a doctor proudly presented a before and after image after lip filler. And I was quite shocked about it, to be honest, because they had essentially committed all 6 cardinal sins of lip fillers. And I will tell you exactly what they are so you can avoid them. But before I start, I just wanted to say that lip fillers really have a place in aesthetic medicine, in particular in more mature patients actually. And that's because our lips lose volume as we age. And the consequence of that are lipstick bleed lines on and around the lips, plus a loss of definition and a thinning of the body of the lips. All of this can be corrected very nicely with a filler treatment if done correctly. And the outcome will look 100% natural. Nobody would ever know that you had a lip filler treatment. Your lips will just go back to how they looked maybe 10 or 20 years ago. So let's talk about those 6 very common mistakes. Number 1, the wrong choice of product. So all lip fillers, or the vast majority anyway, contain hyaluronic acid. But there are really big differences between different brands and between different products of the same brand even. And the key here is to not choose a product that is too stiff or viscous. If the doctor is using one of those products, then whatever they do, the outcome will look unnatural. Mistake number 2. They may have used the correct type of product, but they simply use too much of it. And too much is not easy to actually quantify. So 1 milliliter of lip filler does not equal always 1 milliliter, because if they used a thicker product, 1 milliliter may look hugely overdone, whereas if a very soft, lovely liquid product is used, then 1 milliliter can look completely natural. But even with a very soft product, we often don't even need as much as 1 milliliter. So when I do lips, especially if the lips are naturally thinner, I may use as little as 0.4 milliliter in total. But of course that's very individual and we have to tailor it to the individual anatomy. Mistake number 3 is that often the lips are treated in isolation. What I mean when I say that is that the filler is only injected into the lips themselves. But in my clinical experience, it looks much more natural if we treat the lips, but we also treat the skin area around the lips, because otherwise the lips can look really weirdly stuck on, and lack for a better word. Mistake number 4 is to make the upper and the lower lip the same size. That looks really, really unnatural. So the ratio of upper to lower lip is extremely important, and the most attractive lip ratio has been shown to be 1/3 for the upper lip to 2/3 for the bottom lip. And that's following roughly the golden ratio. There are, of course, ethnic variations, and the 1/3, 2/3 rule is relevant definitely for Caucasian and Asian faces, while in black patients the ratio is maybe a little closer to 1:1. Mistake number 5 is to accentuate the borders of the lip, what we call the vermilion border. So that's the border between the red of the lip and the surrounding skin. And if we accentuate that with a lip filler, then again, this looks unnatural. There is a kind of sharp step between the red of the lip and the surrounding skin, and that should really be avoided, in my opinion. Yes, we do lose definition as we get older, but we do not have to accentuate or over-accentuate that lost definition. That's just the wrong way. The definition will be automatically restored when we treat the lips, and we do not have to succumb to exaggerating that. This brings me to mistake number 6, which is to inject too much lateral volume. So if too much filler product is injected in the sides of the lip, in particular the lower lip, then the lips will end up looking square in a way. And that's a dead giveaway of a badly done filler treatment. So in fact, all of the things I mentioned are giveaways that the patient had a filler treatment, and when a filler treatment is done nicely, you would never know. But the kind of that square look of the lower lip is something that I very often see on Instagram, for example, and that I feel very strongly about should be avoided. So that was my top 6 of aesthetic filler treatment mistakes. I hope this all made sense, and I will speak to you again soon.